Hello.
Hi.
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 Okay. It's good that I can see everyone joining. How are you all doing today?
Good.
Good.
How
How
are
about
you?
you?
I'm doing good. Did you guys do anything this Sunday?
Oh, well, I have three exams coming up, so
Okay.
Okay.
I have
I
a lot
mean,
of
I
exams.
I can show my PPT right ahead of me.
Oh, wow. Okay. So
I have
everyone's having exam
I,
now.
I have endo, then perio and pharmacology coming up
Okay.
back to
Yeah, I
back.
just finished my pharmacology and I have radiology this week, so I'm a little on
Ca-
a
Can
lighter
you
side.
share some questions, please? Let's do a prep session for each other.
The
I'll help you
Definitely.
viewers
with.
will be a little confused for what did they come. I mean, like already preparing for DDS exams, so like is it bench prep now? But I think we already have a good number of people joining today, and I do want to start by saying welcome everyone,
Thank you.
and a big welcome to the speakers as well. I know it's your exam time, and you've still taken the time to be here with us live and help everyone who are preparing for their bench exams. If you want to start by shortly introducing yourself, which year you are, where you're studying, and then we can go from there.
Okay, I think I can
Yeah.
go ahead. So, hi everyone. I am Dhritika Bhatia, and I am from Temple University. I'm in D2, about to go to D3. It's like a transition that we do. So, Temple University just has a short summer course before the D3 starts. So, I'm in that transition right now. And yeah, I'm excited to meet all of you guys.
All right. And
Okay.
Dr. Kirtana, you can go ahead.
Hi guys, I am Kirtana. I'm from India and I'm an endodontist back home. So I started my DDS journey at UNLV School of Dental Medicine this year. So I'm currently a D2 and will be moving to D3 from the fall of this year. So yeah, it's a 2-year program. UNLV has a 2-year advanced standing program, which is the DDS degree that you'll be earning. So yeah, so that's about it.
And yep, I think we can, Dr. Monica, just in time.
Yeah.
I did notice you were kind of stuck in here, but you're back. Do
Okay.
you want to go ahead and introduce yourself as well?
Yes, yes. So thank you everyone. Thank you for the opportunity first. So I'm Nagamaunika Bhamdipati. So I'm a current D2 student at Nova Southeastern University, and yeah, that's it.
Okay.
Mhm.
And hi everyone, for those who are joining first time, I'm Dr. Asta Vas and also hosting this live for you all. Besides that, I do want to say that you guys have probably seen Dr. Ritika, Dr. Kirtana, and Dr. Naga as as a part of our mentorship initiative. They're all the DSS ambassadors as well, and they're very supportive and helpful. And for the past couple of months, they have been being playing a big part in the DSS mentorship initiative and helping out a lot of people with their preparation to cap it or pass. And now we are here together to help you all with the bench prep exams. And for those who have gotten invites, congratulations on that. And for those who are preparing for it, also welcome. So, first of all, we'll be beginning with a couple of poll questions that we had a few days ago on Instagram, and we did get quite a few good questions. So the first question will start with Dr. Ritika. Is bench prep necessary?
Um, some universities have bench prep compulsory, so it depends on which university you apply to. I think we have shared resources in our group as well, wherein they have the list of universities that don't have bench prep and those that have bench prep.
Yeah.
I would personally feel that I personally feel that bench prep helps you because as soon as you go to the college, they give you a lot of stuff to do. So for me, we had a lot of exams right from the first or the second week, which included practical. So I think it's a good practice to do bench test because it gives you an idea of how you could excel while in school. So.
Okay, so for those people who want to find out where the information or whether the school is conducting bench exams, so where can they do that?
To me?
Um,
To me. Okay.
Yeah, anyone can
any,
jump in and answer.
you can
Yeah.
go ahead. You can go
Go
ahead.
ahead.
That's
Go
fine.
ahead. That's fine.
I mean, I got the information from the Capit question bank that is shared all over. I think
Yeah, so
everyone has it at
there are a
this
lot of
point.
WhatsApp groups and
Yeah,
Facebook
WhatsApp
groups
group,
that we're all
basically.
part of. So people kind of keep sharing that one template over the years. But I would
Yeah.
suggest that please check with the updated protocols because some schools keep changing things every year. Or
Yeah.
maybe not every year, but I mean, more or less the preps will remain the same. It would be a class 2 or a class 3 or a crown prep, but they might change from PFM to zirconia, zirconia to metal, or
They
I
may
think
add stuff
very few.
too. I've seen people add like inlays,
Yeah,
onlays. I've seen that as well.
true.
That has been added
Okay.
recently, I
They
think.
keep adding things, so they should be updated with the current thing because every cycle, the requirements change, and maybe since we applied last cycle, we might not know what is there for this cycle. So it's better to
Yeah.
follow what's going on in the group, or you can even contact. I think some schools even put it on their website,
Yes.
or once
Yeah.
you get an invite, I think some of them share instructions as to you will be asked so and so things. And some
Yeah.
schools like UNLV, which have like a 3-day interview, come bench, come written exam, they give you a day to practice. So the
Okay.
first day when you come, you can give your interview. The first day will be interview usually. They will basically divide you into two groups. First group goes in for interview, um, and then the other group can practice.
Okay.
Then in the second half, I think they interchange, and during the written exam also they give you time to practice, and third day will be your bench exam. So you
So which
have enough
school
time
is
to
this?
practice. UNLV,
UNLV.
University of Nevada,
UNLV.
Las Vegas. Yes,
Okay. Is it
I
the
Yeah,
same
you,
with Temple
I
or
don't
it
know
is
NSU?
the same.
every
So,
It's the
school
same
does
with
that.
NSU. NSU, they have 2 day bench. On the first day, there's an interview, and parallel you can practice. And
Okay.
second day, it's bench. So in that way, you'll have, you can set all the speeds and everything for the electronic,
Yes,
like for the electric
handpiece.
hand pieces.
yeah.
So
Okay.
you can
True.
just make, even though you don't do a good preps, that's fine. That's fine. They will evaluate your preps also on the first day. That
So
gives you
they
a little
So
confidence,
they
if you're
give
doing
you a
really
rubric.
good.
Yeah, they usually give you a rubric. So every school has their own, what do you call, maybe criteria or requirements that you need to fulfill.
Okay.
So if they say
Okay.
class two, you don't have to memorize the measurements of class two. When you go to the bench prep, they usually give you a rubric. Rubric is basically like a handbook for suppose. It's just a sheet of paper which has the measurements. It doesn't have exact measurements. They say stay within 1 to 1.5 mm.
Yeah. Okay.
Okay, so you need to stay between 1 to 1.5 mm. If you go above 1.5 mm or if you are below 1 mm, then maybe you're not sticking to the criteria that they have given you. So then you
Yeah.
might fail. So basically, it's just pass or fail. There's no 100, 90, 80. There's no points for your bench exam. It's just whether you pass or you fail. And how do you determine whether you pass or fail? If you're following what is in the rubric, then you will pass automatically.
Okay.
So,
If you're
Okay.
1.3, 1.1, 1.4, you'll still pass because you're between
mhm.
1 and 1.5.
Yeah,
So
adding
like
to
adding to that,
yeah.
oh, I'm sorry.
You go. No,
So
no, you go
adding
ahead.
to that,
Yeah.
yeah. So Temple University actually gave us the rubrics, the words that are used, as well as what is to be asked, like about, I think, 2 weeks before the exam, although they didn't give
Okay.
us the time to practice. But I think that a lot of universities are now converting to electric handpieces. And Temple University was with air driven. Now we've converted to electric as well.
Okay.
But that's the reason they give us one more day. Like most of the universities, I also gave the branch for UNLV, and it was an electric handpiece. So
Okay.
if you want to like know the difference between the two, I can share that with you as well.
Yeah.
But Temple University did give us a rubric, and I can basically share that. It's very, very similar to ADEX. So if you search ADEX exam PFM prep, you will know like what is the rubrics. You'll get the sheet of the rubrics, and you get to know like what is what, like what is clinically acceptable, what is okay, and what is not acceptable. So there's like a whole list of things that are there that they see. And I think it's
Okay.
mostly similar for all the other universities
I
as well.
think
Yeah,
we
to
do.
that,
Yeah.
added to
Go
that,
ahead.
I give Buffalo too, and I was accepted there. So with Buffalo, it's not like this. They don't give anything. They literally, so, but you have an option. You can choose between air driven and electric. You can choose the handpiece, but I always tell, choose electric.
Yeah.
It's
Okay.
easier, it's nice and easier, definitely. People say it's heavy and it's difficult, but I would say it is really nice. Even though so I practiced with air driven at home, but I chose electric because with NSU I already cleared that pen, so I chose electric. It's really easy. First and
Okay.
second, Buffalo, they don't give any rubrics. They don't even tell what they'll only tell what exercises they give, and that too very vaguely. You
Okay.
cannot even imagine. Like it's like it's a big ocean, and you don't know what to do and where to do,
Okay.
and you have to clear the bench, and then you have to go to interview.
Okay.
And they're I don't say they're strict or they're easy, but they're a little no, they give you a choice, like you can do whatever you want. They don't even give the rubrics. They tell use your intelligence,
Okay.
use your clinical intelligence and do. So so there are schools like that who doesn't give anything and you have to do it. So for those schools, I always say like use edX. That's the basic thing any school follows. So use the edX
Okay.
criteria and prepare. And a basic knowledge of what we already studied, like for how much it should be for amalgam, how much it should be for composite,
Yeah.
and all really helps. And add to this VCU, they have one of the preparations where you have to make temporary crown
Okay.
preparation,
Provisional,
Oh,
yes.
provisional
okay.
or temporary crown preparation. So it's one of the vast bench tests I've attended. It's like six, even Buffalo was 6 hours, but 5 exercises. VCU was 6 hours with 6 exercises. It's like
Okay.
really huge.
That's
And
pretty
the
hectic.
yeah, and that the kind of material they use is not something that I used in India. We were making with resin, not resin, like
Composite, uh,
not even the
ac-
composite, like acrylic.
yes,
Acrylic
acrylic solid.
acrylic
Okay.
temporaries, but here they give a resin like a tube and it's light
Yeah,
curable and all.
yes.
So kind of things like that. We need to
Different.
be a little more, you know,
Okay. I
practice
mean,
that. Yeah.
I think we've already discussed a lot. Although I have like a set of questions, I can see that we've already come out with all a little bit of those questions. I do want to say for those who have joined now, we also have Dr. Jagriti with us in the chat box, and she's also from UAB, an international dentist, and pursuing her DDS in the US. And she's also answering questions for those who are commenting in the chat box as well. So we just to summarize a little bit, you guys have said that electric handprints is the trend now. So everybody needs to start with that. And every school, most of the schools will give you a criteria or a rubric on the day of your bench exam, providing you with a range of things that you might need to cover when you're doing the preparing your tooth. And what else did we? Okay. And also I think we came across the fact that the hours can be more in certain schools. So
Yes.
and we discussed like, particularly a lot of schools came out, names of the schools came out, and how they do it differently in each school. So, what do you have to like, or provide a tip for those who are not expecting long hours? Do you know the previous day that how many hours your bench
Yeah,
exam is
yeah.
going to be?
Yeah,
They will.
yeah.
They will. They
We
will
Okay,
know
tell
it.
you. You-
They email you everything like much prior to
okay,
your day of interview or
okay,
bench. They tell you
At
everything.
least at
They
least a
tell you
week
when
or
is the lunch
week or more.
break,
Yeah.
what is in the morning session, what is in the afternoon session. Everything is mentioned in the email.
Yeah, some
So I don't
schools
think it
they
would be a
have
surprise.
some schools they have thing like you have to definitely take a lunch break.
okay,
Some schools
Yes.
are like easy on that, like you can use your lunch break also for preparation and bench. So Buffalo, I used like the entire hours. I did not take a lunch. Not me. I think nobody took lunch. So
Okay.
you
okay.
can just use everything for the preparation. And one more thing I thought of adding to this, the preparations they'll
Mm-hmm,
give majorly it's like class two amalgam preparation and
mm-hmm.
restoration, class to composite preparation and restoration, and
Class three.
crown cutting. Yeah, maybe for some schools
Yeah.
it's class three too.
UNLV has class three and
Okay,
class two
Yeah.
and one crown
okay,
prep.
One, yeah. Crown curve, it can be anterior or posterior.
Yes.
Anterior, it's usually definitely it will
Zirconia,
be zirconia or PFM, like
yes,
something aesthetically
or
related.
ceramic. Yeah.
Posterior, it would
Would
be
be metal or
go with,
PFM.
yeah, metal, yeah,
okay.
PFM.
And
And
is
one
And
the
of the schools
okay,
also has surveying. I don't know which
I
school.
heard that
Surveying.
that one was for VCU before. It
They
used to have surveying,
removed it
but
now.
off late, yeah, they removed surveying, but they still have
temporary crown?
Cast
temporary
partial
Okay,
test.
crown. And I
Okay.
think for Tuoro also, I read somewhere that they have surveying. Tuoro has a very extensive bench.
Even,
I saw somebody posted in the group when I was preparing for the bench. They have like a 2-day bench and
Okay.
like
okay.
crazy
I
exercises they
think
have.
even Michigan. Again has a bridge that you have to make. It's the same thing,
Yeah.
but you have to do a
Hmm.
molar and a premolar in like 3 hours. So it depends. Every school has their own way of doing things.
Yes.
Okay. And so next question would be, we discuss about what kind of procedures, will be asked in the bench and how do you prepare for it? You kind of get the schedule the previous day on how the day goes. Besides that, are you being evaluated on, besides the bench, how you do the bench that day? Are you also getting evaluated on how you're presenting yourself that day? If is there like a side-by-side interview going on hand in hand when you're working on bench preps, or are you being observed or anything like that?
Yes.
I think it's always better to be presentable, but it depends on the school as well. So I remember, like in Temple University, they told me we do not judge you based on how you are doing prep, but just don't do it direct vision. So that's what they do. They did tell us that if you have any questions, just let us know before the bench starts.
Okay.
So, but some of the universities I know, Colorado specifically, have marks, or they do look at people and how they prepare, how they are, and what's their posture before the exam. So
Yeah,
that
Okay.
matters.
I think it's really important. Like she said, of course, it depends on the school, but I would say like be on the safer side. Just be presentable throughout when you're in the school or when you're talking to the staff or faculty, or even if they're not faculty, if they're somebody at the dispensary giving you a
Yeah.
bird or something, try to be nice. Try not to be like, okay, just give me that, or can't you just give me one more extra matrix band or something. Don't say like that. Just say
Yeah.
please. Just say
Yeah.
thank you after you take it. I know there's a shortage of time, you are in stress, you might forget to address somebody, but try to make it a point that even if somebody is giving you a piece of cotton or gauze, just say thank you.
Yeah.
That's the least we
Yeah.
can do, right? Because
Yeah.
even they are working on a day that they're not supposed to work just because it's your interview, your bench, and everything.
Yeah.
So just at least be nice to them. Also, I would say that any school which has a bench will definitely have interview. Some schools have an additional component, which is a written exam.
Hmm.
So I would say focus more on the interview and the bench,
Okay.
because
Yeah.
those are two things where people are actually noticing you, observing you. Okay.
Yeah.
Even in bench, it's not just your preparation, it's about your positioning, your chair positioning, how you are sitting, your ergonomics. Okay. Loops, I would say preferably yes. It will give an impression that you actually care about what you're doing rather than just coming there and doing whatever you want. Of course, some people might not have loops. I wouldn't say just buy loops for the bench. If you have loops, please take them. If you
Yeah.
don't have loops, if you're still comfortable doing good preps, then just practice more, maybe. Because definitely a person who is using loops might be able to see better. I don't know
Yeah.
if they'll be able to do better preps or not, but they'll definitely be able to see better. So you need to practice more so that you are comfortable with what you're preparing without the loops.
Added
Yes,
Okay.
to
That's
that,
good.
added to that, I can tell somebody who uses loops can really make a good trip compared
yes.
to who doesn't use.
Yeah.
That's
I mean,
for my
But
personal
but what
experience.
but what if they're using
But
it for the first time on the day
that's
of
what
bench?
I was telling, not on the bench. So you will definitely
yeah.
know when you got the interview invite or bench invite.
Yes.
It would be at least 15 days ahead.
Yeah.
Yes, prior.
Yeah.
So from
Yes.
the
Please
day one,
practice.
when you are practicing for the bench, start trying with the loops. It only takes 1 or 2 days for you to get accustomed. I don't say it,
Yeah.
at least for me, it was not more than that. It was new initially. Don't spend too much money on that. Just
Yeah.
buy
Yeah.
Amazon one that
Yeah,
I
even
works
the
well.
say
Amazon
That's
I
one
just
got
should
it
be
from
fine
Amazon
I
like
got
for
very
a
cheap.
day because it's
Yeah.
Yeah.
just a day of bench, right? So it should
so
be fine.
you use for 15 days before bench, and then you give bench, and hopefully touch wood, you'll get accepted, and that's it. You
I
won't use it
also
again.
feel that,
So
sorry, I also feel
definitely,
that the loops with lights is much
Yeah.
better because you get see. I think loops is what I feel. I feel that loops are better because of the light, not because of the magnification. So you
yeah,
can
and
just see
your
better when you have loops with light.
and
That's the
your
reason I thought
ergo
the
will
loops are better.
automatically be
Yes.
Yeah,
good. When
yeah,
you
that's
You
what I
start
don't
mean.
have
using
to
loops,
bend or,
you will,
see
yeah,
this way or
yeah,
anything.
Yeah.
you will
Yes.
not bend, and you will definitely be on a good side, even though this grade you or they don't grade you,
Yeah.
you'll definitely be on a better side. And buy just Amazon one, $50, not more
Yeah.
than
And
that,
just
just
Yeah.
for the
return
bench.
it. Just
Yeah.
return it if you don't want to
If
keep
you
it.
can, yeah,
Yeah.
if you can return it,
I
you
would
can
love
keep
to
it. And
share. I have bought one loop from Amazon because I also heard that I second the fact that you don't have to spend a lot on the loops right now because once you get into the school,
You'll
you kind
anyways
of, yeah,
buy.
come across different brands and you can choose the right one for you. But when you're starting with preparation, you can always start with certain the one that I got from Amazon
with
and I will definitely share
3.5,
that.
I just want to add
Yeah,
with 3.5
3.5x
magnification,
preferable.
that's good.
yeah.
And yeah, it will definitely
Yeah.
help.
Yeah,
And
and I
Yes.
will
Yeah,
uh,
I
definitely
can
share
just say.
that link on Amazon after this story on our store, the story highlight section. So if you guys want to see which loops you want to go start with, it's a good way to begin. And also looking for loops that come with lights, right? Sometimes some loops come without the lights, so just try
Mhm.
to make sure you read up on what kind of lights work for.
Description. Yeah.
Yeah,
And
so there's,
for
yeah,
somebody who have glasses like me, take a big frame glass, not like a frameless. Take a big frame glass and put the loops on top of it. I did the same thing.
okay,
People might
that's a
think like
great tip.
I have glasses, I cannot use the $50 one. No, take a big size, keep it on this, and you'll have a thread to that.
Yes,
Tie
you
it
can
Yeah,
here.
tighten it.
Yeah,
yeah.
it won't fall down. So it will
Okay.
definitely help.
Perfect. I like that tip, Dr. Naga. Thanks for
Yeah.
bringing that out as well. And
okay.
now going ahead with how do we start, right? So like I know we'll come back to the part we kind of discussed about what will happen for those who got the invite. But now for those who have not gotten a bench exam invite yet, what is your advice on should they start? And should they wait until they get the bench exam invite or what are your tips on that? We can start with Dr. Dritika here.
Yeah, so I definitely think that buying the bench prep, the entire thing, you can buy it off Amazon or you can get it from someone who's already given the bench, like a secondhand one. I got the secondhand one from someone really cheap. And I think
Mm-hmm.
that that just motivates me to start because I was a
Yeah,
person who was applying for universities that didn't have a bench in the beginning, but then I got to know I'll anyways have to do it. So once I got it and I made the investment about like $200 or something, then I know that I have to use it because I've
yeah.
already given the money. You know, it's like a gym membership. Even if you like, you have to
You
give
don't
the
want to
money in
go,
order
but
to
you have to
start.
go.
Yeah.
Yeah,
So that's how I started it. I was like not confident in the beginning, but I think that because I was working non-clinical, I was into research. So, going back to clinical field, it's a little difficult at beginning, but the more you practice, the more you get to know how it's to be done. So even if I didn't get the invite, I was already practicing and I was ready. Once I submitted my application, even before I submitted my application in January, I had started the bench prep, like just one prep, two prep a day, whenever I got the time. I think that just beginning it, starting it gives you that
yeah,
confidence by the end. Um,
True.
yeah.
Because if
um,
like if you receive a bench invite and they say that, like, for suppose today is June, if they say that your bench exam is on June 20th, for suppose, okay, and you don't have time to start and you
yeah,
don't know where to start because you will then think about buying the burrs, which bird to buy, which tooth, which typodont should I practice on, which handpiece should I use, what speed should I set it up. There are so many questions in your head. So I would say the minute you submit your CAPID and finishing your Kira or Casper or whatever additional exams you have, maybe mid of May or at least end of May, if you people have submitted your CAPID applications, just start practicing. Like every day, 2 class 2s shouldn't take so long. Even if you're
yeah,
a fresh grad, even if you're if you're not doing class 2s or class 3s for a really long time, at least do 1 or 2 every day, I would say,
yeah,
especially for those who are working in a clinical setup, like if they're a dental assistant or a hygienist or shadowing, just ask your dental clinic owner if if you can practice, because that's what I did. Luckily my dentists were very, very supportive. They said you can take the chair for the entire day because their offices were not so busy certain days. So I would go on that day and this just practice for like 4 or 5 hours at a stretch, and I could do like maybe 3 or 4 class 2s and 2 class 3s or something like that. So I think everybody has their own speed and everything. So it's fine even if you're doing 1 class 2 for 4 hours, just
yeah,
practice.
yeah. I do
Yeah.
have another question. Is there any difference with the type of tooth you're working on, the typhodons?
Yes.
I would say like whatever the school gives, try to practice on that. Don't like it's good to practice on Amazon. I don't deny that they're bad, or people who practice on them also got into the schools. But from my personal experience, you wouldn't be, surprised on the day of the exam. So if the school gives Acadental, use Acadental. If it gives skill core, use skill core.
Yes.
In that way, you will get used to the anatomy. Some brands have a different anatomy
Yes.
compared to others.
Mhm.
I don't know about which tooth cuts fast, which is harder, and all those, but I would
Hmm.
say just use
The
what the school gives you
school is giving you. Yes.
first. And
So,
second, Ashley
how
told
would
it's
we know?
always good to practice. It is always good to practice beforehand, but always
Mhm.
finances come into too, right?
Yeah,
When you
yeah.
start practicing, that's also a big thing. So what I would say is watch. If you can go to bench test prep course, that's definitely good. If not, watch Stevenson dental videos like n
Yeah.
number of times, not just once or twice. Watch hundreds of times. Every time you learn a different technique, different tip, that will definitely help you in your bench. If you can go to his bench test course, that's good. If you cannot go also, that's totally fine. I know my friends who got into dental school without going to his bench test, but just saw his videos. That's really, they are like Bible of the bench test for me, at least. I would say that. How mental dental are like for INVDE, his videos are for bench, definitely. So try to watch his videos as soon as you get the bench test invitation, depending upon how is your schedule day to day. Try to practice as many times as you can. From then you
So
have to practice like like not like one or two preps a day. Try to practice more and more, like how many ever times you can do. That will definitely help. Before, if you are on a little lower side with the hand skill, then try to practice on and off. But if you think your hand skills are good, where you did a decent job before and you already went to the bench test prep and you know what schools are expecting from you, then just practice as soon as you get the bench invite.
Invite.
Yeah.
I want to
And
add up.
yeah,
So
go ahead.
sorry. So yeah, I was practicing on a Columbia
Okay.
tooth jaw typodont. But when I gave the exam, I got to know how different it is. So like Module Pro, that usually Akadental, that
Yeah.
most of the schools usually use right now, they are softer. Softer is in the as in they are easier to nick as compared to the Columbia
And
one that I
faster.
was using. So it depends like which one is there, but I would definitely suggest, as they said, if finance isn't an option, you should go for Module Pro Accidental. And I think you can always ask in the group, and
Yeah.
if someone has given the bench previously, they can share where did they, which jaw set was used. I did it for Columbia because I was not aware that there are other brands when I was doing my practice. But it's always good to at least have some teeth of the other brand just to see how easy it is to drill the tooth, how easy it is to nick the adjacent tooth.
Before
Because
Yeah.
that's like a
leaving, I
critical
would.
error. Once you touch the adjacent tooth,
Adjacent.
you are failed. So
Also, you
you
can
have to
use
take care of it.
matrix bands or
Yeah,
fender
fender
wedges. There's
wedges.
something called as fender wedge,
Okay.
where you have a wedge and a matrix strip.
Okay.
It doesn't go around the tooth. It's just for the proximal box. I mean, for proximal contact between two
Okay.
teeth. You can just push a wedge, and the wedge, if this is the wedge, you will have a matrix band also on top of it, attached to the wedge.
Like a small
So
Okay.
it's just a wedge
piece
and a
of
matrix
matrix.
band strip, just in the proximal. So when you're doing your crown prep for the interproximal portion or for a class 2 box, just put your fender wedge. Also add one more matrix band on the other side if you want, so that if you're very much scared that you'll even nick the fender
Yeah.
wedge strip, just put another matrix band. If they're giving, good. Just put how many ever you can fit there and then prepare. If you're very, very
Yeah.
scared.
Okay.
Yeah, majority of the schools give fender
Yes.
wedge. Ask them, take them couple of
Okay.
extras,
They
not
might
like
not
it's
give it
okay.
to you, but if you ask, they will definitely give because they
They'll
might not
definitely.
remember. They might just
Okay.
give you the burrs and the handpiece and the typodont and the jaw. You can go and ask them for matrix band or a fender wedge. They will
Okay.
One tip
definitely
is
give.
fender wedges are really sharp than matrix bands. So I use them. I just pass them in between the like the proximal contact. They give that exact 1.5 mm what you need at the
Yes.
gingival
Okay.
contact.
Yes.
So I use that rather than going too deep with the burr, and you might end up having 1 mm or like 0.75. So it's always good to go as like that 3 mm from the occlusal surface, and then pass the fender wedge.
Yes.
It is really
Break
sharp.
the
It will
contact.
cut the tooth structure exactly 0.5 mm what you wanted for the
Yes.
wedge. So
Okay.
that's really good. Yeah.
And thank you so much, Dr. Naga, for joining us in this session.
Yeah.
And I know it's a short period of time, but I do want to say that you've shared valuable tips to us. And hopefully, we'll do this another time where you can join us for a longer time.
Sure,
And
definitely. Yeah,
okay.
thank you so much. I had a good time too. If possible, I can be in the
Yep,
chat and I can
of
just
course,
answer
that
their
would work on.
questions. Yeah, sure.
Okay.
Thank you.
And yep, you're welcome. And we have another guest speaker joining us as well. Just give me a moment and we will add her too. So we did discuss about the type of tooth and everything. So just to summarize for those who have joined, I understand that it's better to practice in an electric handpiece, and it's a good idea to practice on accidental teeth, right? Because now that's the trend in the
Yes,
schools.
most of the schools use accidental, but if
Okay.
some school is using Kilgore, and if you have access to somebody who is already in that school or who has given a bench from that school or any YouTube videos, just go through those and then just practice on that tape. Mostly it would be accidental.
So the next question is that are the bench exam very different in every school?
I think, like mentioned earlier, most of the schools stick to class 2, class 3, and ground preps, whether
Okay.
PFM or metal or all ceramic or zirconia. So, those things are something that are common to like most of the schools. So, you
Okay.
can maybe start practicing with that. And if some school has, maybe two class 2s and one class 3, or two class 2s and one ground prep, it's just a
Okay.
mixture of things.
Okay.
More or less, all the procedures remain the same. It's just how many number of these exercises are they going to
Yeah.
Okay.
ask.
And I'd say that not just do class two and
I think Dr. Ditika just cut
Yeah.
off from the conversation. She'll be joining us in a
Yeah.
while. Hi, Dr. Utsavi, for joining us and sharing your tips right now with us. So welcome. Do you want to start by introducing yourself, which school you are, and which year you are doing?
Yes, hi, good evening, everybody, and good morning, when whichever part of the world you may are. So, I'm Utsavika Padya, and currently I'm a D2 student at Tufts University School of Dental Medicine. And then I will be joining clinics starting from next month, so I'm kind of excited about that. And yes, so basically, like Tufts does not require bench test,
Okay.
but I have given bench tests at other schools, and also like I prepared for bench test a lot because I always wanted to make sure, like, my hand skills are good, even if that school doesn't require, because ultimately, when you get into the school, you will anyway have all the
Yeah, I think we lost Dr. Utsavi in the
Is there a
middle.
problem when when more than three
yeah,
are in the
I
call
think
or something? Because when she joined, Ritika
Yeah.
had to.
I think there's probably a glitch happening on Instagram, but we can work through that. I think it just takes a while for it to set out
Okay.
and then it'll get better, I think.
Yeah, Ritika was
Um,
talking something about the bench
yeah. So
yeah,
exercises.
yeah. I was just saying. Can you hear me now?
yeah,
Yeah.
Okay. Yeah, no, I was just saying that don't just practice on the regular teeth, like, like molars,
Yeah.
but also do it on premolars. Like, I know UNLV, they ask class three on a canine, which is very
Yes.
uncommon. You never do it
Yes, they
usually.
never.
So
So
it's
even
like,
during practice, they asked us to practice on a central or a lateral, but
yeah,
during the exam, they asked us to do it on a canine. So they can
okay,
do that. Be prepared. So class 3 doesn't mean every time it's going to be on a central or a maxillary central. It could be on a mandibular central as well. You never know.
okay.
So
Dr. Utsavi, we lost you in the middle. Do you want to
yeah.
continue with what you were just saying?
Yeah, no, I was just saying, like, basically, like, those hand skills can always help you, once you start the dental school. So, like, don't just look at it as like just to path get into the school, but keep practicing, because hand skills are our main, main goal and main, point, that's why we are dentists. So, like, just
Yeah.
keep it going in one or the another way, and then the thing is that working on typhodont is very different than working on
Patient.
patients. So like even if you have like 10 years of home country experience, that's awesome, but unfortunately you have to show your skills on a typhodont.
Typodon, which is
That will
difficult.
prove you, like, if you will be into
And
the
you have
school
to
or
be a
not. So just keep
perfectionist.
Because,
going. Yeah.
yeah, the challenge is on the typodont, you are preparing like how you're preparing on a patient. But the evaluation or the assessment doesn't happen inside the typodont. They're going to take out the jaws and they're going to see it under direct vision. Obviously, they can't do it in a patient's mouth. Maybe even then we might have equal number of errors. But when they see the typodont outside is when you will be at loss if you're making some major error, especially nicking the adjacent tooth or going wide or going too deep or something. So practice that more.
Yeah. And I do see we do have DHS ambassadors in the chat box too answering a couple of questions. And one of our question ahead would be here, what type of burrs should we use for
Uh,
bench test?
So I have a list. I can share. It's like a photo that Temple University gave it to us. It has like all the number of words that is used. Here, the numbering system is a little different than what I had in my home country. So what I would say is just look at the word. Like I just say football word. I don't know
Yeah,
what is the name of the word.
yeah, we don't know the
So
numbers. True.
yeah, so I can share that PDF. I mean, it's a PDF. There are like 2 or 3 stuff
Okay.
that is there. So I can
Okay.
just share
But
that with you
usually
guys.
Yeah.
the school gives you a set number of
Like a
burrs.
list
If it's
of
a class
them.
2, they would give you a 330 and a 245. If it's an inlay or something, then they will give you a 169L burr. If it's a crown prep, they'll give you one shoulder, one chamfer, and one interproximal burr. They're not going to give you like all finishing, polishing burrs
Yeah.
and all. They'll give you very minimal number of burrs. So just practice with the basic stuff. You don't have to buy some extraordinary out of the world burrs or anything. Just stick to your flat for shoulder, chamfer burr and your interproximal, and try to refine your prep with those burrs itself. They might not give you a finishing burr, the yellow band burr
Yeah,
or
they
the
give
red band
yeah, a
burr.
lot
They
of
might not give you. They might just give you
instructions
the
have it.
green band burr. Green band is basically the coarse one. It's not
Course.
the fine burr. So even with that rough coarse burr, you need to have a smooth finish and a regular surface. No irregular, sharp, pointy surfaces you can have on your prep. So try to practice with the basic burrs that you have, or you can order Stevenson's burr kit. I ordered a Stevenson's burr kit. It
Okay.
takes time to come, maybe a week or so. So try to order it prior and always order 2 sets. You cannot take your own burr kit to the exam. They will only
Okay.
give their own burrs. You only have to do the prep with their burrs. But for you to practice at home, just buy 1 or 2 Stevenson's burr kits and keep it with you, because when you're preparing more teeth, the burrs tend to wear off, right? So at least have
Yeah.
2 sets and keep practicing with them.
Are those burrs similar to the burrs you get in the schools?
Kind of.
Most of them,
But
Pretty
again,
most
much.
of them,
Stevenson's
they
burr
have
kit
like
has a
some
lot of
extra.
burrs.
Yeah.
Yeah, Stevenson's burr kit has a lot of
Yeah,
burrs. They have like maybe
that's
8
what
to
I
10
noticed.
burrs. College will
Yeah,
only give you 3 or 4. Don't expect 8 or 9
exactly.
burrs. Yes.
Yeah. Yeah, and I do want to say that I know Dr. Ritika, you mentioned you have a lot of resources in PDF files, and we will be putting up a WhatsApp group for everyone after this live, so y'all can join in. And Dr. Ritika, please feel free to share those in
Yeah.
the groups with us. So we have another question, which is you all can take turns. It's asking, can you all just mention your favorite birds for class 2 and crown prep?
I am a person who would do everything with a 330 word because I don't want to change my words, but I don't know. A lot of people like especially for like class 1, class 2, I just use that one word for everything.
Okay.
Even for chamfer shoulder, I use the basic chamfer and the shoulder word, just one word. For smoothening, like some colleges didn't give us the yellow burr. I just used the
Yes.
same burr in slow speed in order to
Okay.
get that smoothening effect. I think that it works for me, but I don't know if someone else has something. I try to keep it as simple as possible. I don't like changing a lot of words, but someone else could have some other opinion as well.
Yeah,
Okay.
for me, like I basically prepare like occlusal just with 330 burr, but then a box I prefer to do with like 245 after the initial ditch I have for the box, because I think that just gives me the idea about the depth of the box, and like how I can curve the give the S curve, maybe, like, and then go on the buccal side, because there is always less clearance on lingual and little more on buccal. So
Yeah.
for me, like 3:30 and 2:45 work that way. And how Dr. Zilka mentioned, like for crown prep, it's like mainly shoulder and chamfer, and then when you don't get more burrs, you just have to use them on slow speed. So that's what I used to do as well. Like even for my practicing, like I did not use many burrs. Actually, I did not even have a Stevenson burr kit. I actually just had like all 4 or 5 of these burrs. I just repeatedly, but my thing was that I kept buying more burrs of those only. So then, like if the burrs are like really easy to get wear of with lots of practicing. So then I used to have like some extra pairs of them. But yeah, so I just used to use this like 5 or 6 basic burrs. That's it.
Okay.
Yeah.
And so I have the next question where we can discuss about resources, and I will start with Dr. Kirtana. You can tell us about what are the resources for people that is available to start preparing on bench prep. And Dr. Ditika, your question would be what are the resources for a person to buy the materials for bench prep from where they can get it? And and I think Dr. Utsavi, you can tell us which places you bought your stuff from. So we'll go in that order. Dr. Keetana, you can start by telling us about the resources for preparing for the exam.
Okay, so like Dr. Naga mentioned already, I think you can stick to the Dr. Stevenson's videos on YouTube. That is one thing. That is for people who cannot go and attend a bench course in person. But if you want, and if you're able to go in person, I would suggest go in person. Whether you are a person who has had a lot of clinical experience or not, it's not about learning something new. You're not learning anything. Even in school, you're not learning anything new. You're just understanding how things are done in this country.
Yeah,
Okay? How you have to fulfill the requirements of the people over here, or the college or the curriculum over here. Same thing applies to your bench prep or bench test or bench exam. Okay, so now coming to the resources, one is Stevenson's or Duggan's courses, which happen in person. You have Stevenson's online videos as well. Now, there's another one, Dr. Shalini Tasma in Texas, in Dallas, Texas. She conducts like a 2 day or a. So I went for the 2 day thing, not because I wanted to learn how to do a class two, but because I wanted to see if my class two is acceptable in this country. Okay.
yeah,
And also to find out which school has which kind of preparation requirements and stuff. Like I mentioned, right? Every school has a different requirement. Somebody asks you for a class two, somebody class three and all. So when you go to such bench courses, I'm not promoting anybody's bench course, but whichever bench course you're going to, there might be more
yeah,
that I don't know. Whichever bench course you're going to, first thoroughly go through their curriculum or their program. What are they teaching? What are they providing you? And what are their references? So if Stevenson is teaching you something, what is his reference? Like where is he taking those measurements from? Or
yeah,
which schools accept his kind of preparations? Okay, so they will have some template or a PDF or something, right? So talk to the course director, whoever is conducting that course, and try to find out about the program first. Don't just blindly go just
yeah,
because people have been telling you to go. I
yeah,
can say Stevenson's, and doesn't mean everybody has to go to Stevenson. Somebody else might like Dr. Shalini Tasma, somebody else might like Duggins, or somebody might like something else.
yeah,
So see what you
Can
want to learn.
I?
Yeah, please add.
No, I'm just adding. Yeah, I think like I because I was working, I didn't have the time to take the
To
bench course because we had to take like 2 weeks off, and I was working in a different company. So what I did was, I don't know if she does it now or not, but if you guys don't know, there's someone called as Casey Dentistry.
yeah,
He is, I think she's also been in this DDS Student Society
yeah,
before. But yeah, she, during the, I don't know if she's doing it this year or not, but what she does is she does a really short, like remote session. And then you can send her as many preps as you want. And then what she does is evaluates all the prep and then says, how do you not just how do you do it, but like how do you improve? Like how do you smooth?
yeah,
Which word do you use to smoothen it out? Or what are your basic, like you don't know how to make the functional cuts, she'll teach you how to do it. Like she's always available on
yeah,
WhatsApp. and she's like remotely available. I didn't do a bench test because I didn't have the time to do it. But I think that there are more people like that if you search
Yeah.
who
Yes.
can at least evaluate your prep so that you know
Yeah.
which is right or wrong. For me, I thought it was correct, but like,
Yeah.
when someone else
We
sees
need
it, they have
feedback. We
20
need
things to
feedback
add. Yeah.
when you're doing it for the first time in a different place, right? Because
Yeah.
it's different over here.
These are great points because I do believe that you should be able to have connections once you're in the US with a dentist who's having a practice, or any faculty in the
Yeah.
school or something like that if you're in the campus, so that you can always take your work for
And show
evaluation
it
and just
to
kind of,
them.
yeah, get them to share their views or give you the feedback. Additionally, I do see we have a couple of more options given in the chat box, which I will say out loud. That another one is Dr. Jagriti is saying there is one in Florida by Dr. Nato. And I also want to mention, yeah, I agree that Dr. Ryan from Mental Dental, he has started a bench test prep as well. I think it is in North Carolina. Um, and I also want to point out regarding Dr. Duggan's course, there are two Duggan courses with the name Duggan. So which is one is given by Dr. Duggan and one more is given, I forgot her name, but
Megan.
it's Megan, yeah. So she's the dental assistant, but she is trained under Dr. Duggan. So she teaches just like Dr. Duggan, but I just want to put that out that sometimes you might get confused when you just Google it. Make sure the kind you want to, apply for. Besides that, the thing is that all the courses are good. So you just want to make sure where
Yeah.
you want to kind of evaluate yourself. What are
And
you
also it
trying to
comes down
learn
to the
from that?
cost. It also comes down
Exactly.
to the cost. Like for
Yeah.
example, a course which is for 5 days or 7 days will obviously be charging you more,
Yeah.
but
Yeah.
they might be giving you more practice time. Okay.
Exactly. And
But something like Dr. Shalini Tasma's 2 day course,
yeah.
she will teach you all the preparations in 2 days. So you might not get as much practice time over there. So it depends on your level of comfort with
Yeah.
the
Yeah.
preparations. If you're a
Yeah.
beginner, go for a 5 day, 7 day course. If you're already a pro at it, you just want to refine your skills or you just want to brush up, like, revision,
Yeah.
just go to some smaller program. And also, of course, your costs and
Exactly.
financial stuff, because you have
Yeah.
to travel, you have to live in that place. Everything is,
Yeah.
extra, adding every dollar to whatever you're
Yeah.
doing. So you'll have to plan
Yeah.
all of that.
I think another good point is also you can kind of ask them how many students are going to be in that course, because if
Yes.
it's a smaller number, it's more useful for you because you get more one-on-one attention.
Interaction.
Yeah. And it also, like, you can also ask them if you can come early so you can practice more besides the course timings, or can
Yes.
you stay
Stay
back
back
after the
late.
course? Are they open to that? Such things. And certain programs also, like besides bench prep during their course, they also help you with interview preps, or there'll be like a session where they will guide you with anything related to CAPID. So make sure you email them, reach out to them, and show that you want to know more to make an informed decision. And okay, so we did come across a lot of topics today, and I'm just trying to see if there's any questions that we missed out. If there are, please feel free to comment them down in the chat box and we can like go through them as well. um Let me just see quick. I think most of the questions Dr. Jagriti is really helping us out with
Yeah.
answering.
I think she's
Yeah, we
answering like
should give a shout
everything.
out to her.
Thank
She's
you
like
so much.
really into that.
Yeah.
That's really nice
um
that she's
so I
replying all
think
the questions.
so okay, let's talk about like for PFM crowns or zirconia crowns, right? What would be the things that the examiners will check on your prep?
Okay. Yeah, good.
Anyone can go
Yes.
ahead.
Yeah, so basically,
Mhm.
I think starting with the margin, like if how supragingival or subgingival or equigingival your margin is. So usually zero point 0.5 to 1 mm above margin is always recommended.
Prajinjal.
And then always, like, you need to make sure that it is parallel, like your when you are doing the reduction, like basically first plane reduction, second plane reduction, especially for like premolars or incisors, and also
Yeah.
like for molars, then it is also important that it is going parallel to the tooth surface, because sometimes like when it is not parallel, like in your path of insertion will be like slanting, and then when you are giving the final crown, for example, in future, then it would not fit. So then basically you need to make sure that how your plane of reduction is, that also needs to make sure that it is going parallel to the tooth surface. And also another thing is the taper, that we know that about 6 to 10 degree taper should be there, but then
Yeah.
you always need to make sure and check from all the surfaces, because if you're doing just from the buccal side and you see that, oh yes, everything looks good, that's not gonna help you. You just need to make sure that you're checking from all the sides. And then also, I'm sure everybody knows, but at least I can tell you like how we had competence and how our faculty was, pressing on some points. Like always make sure that you are looking at the prep with one eye closing, because otherwise you won't get like the actual, idea that how this should be. And another thing was that your chair position, that is very important, because yes, and don't copy anybody's chair position, but like usually whatever is the recommended, try to follow that, but at the end whatever works best for you. Because if you are like gonna look at the lingual surface by tilting your head, then it's gonna always of course damage your posture. So
Yeah.
try to see like whatever is comfortable for you. And then especially for molar regions, like when we are not able to see like things in the direct vision, especially for upper molar, then see which works best. Like if you need to bring down the chair more or up, and just try to adjust whatever works best. And then also with the anatomy, if I say, like make sure that if you're doing molars, then you are following the cuspal anatomy, because it shouldn't be the flat, like you are not basically just removing everything.
Yeah. Follow
Basically you
the
are
cuspal
just,
inclines.
yeah, exactly. So just make sure that you have those planes over there. For incisor, like yes, try to make the cingulum area that you have over there, because that's how the natural incisor is. So these are like common things that are being stressed. And also like I'm sure it's the same for the bench exam as well. And then make sure if you are not using the loops, that's fine, but I'm pretty sure that examiner who is checking your work, they are using the loops. So just be
Yeah.
aware of that, like how you are prepping, and then you may miss something with your eye, but they might just catch it with the loops because it's always magnified.
Yeah.
Yeah.
Yeah. And I do want to
Also,
say that if you're not using loops, at least make sure you carry an eyewear so that you
Yes.
still show that you are professional when you're working with a typhodont, even if it's not a natural teeth.
yeah, also, yeah, one more thing is protective eyewear is a must, no
Yeah.
matter on what you're doing. So whether it's protective eyewear, your glasses or loops, just wear something. Now, the other thing I wanted to mention was, I think I forgot it, but yeah,
I
so
would like
basically
to
for,
mention, oh, go ahead, sorry. I
sorry.
remembered something. I
Okay,
didn't
then go
want to
ahead.
forget, but
Go ahead, go ahead.
yeah, yeah. So I'm a left-handed person,
Oh,
and like,
yay!
a lot
Me
of,
too.
yeah, a lot of bench test. So it depends on the school as well. But
Yeah.
I did ask Temple University, can I do it on the other side? Because it's unfair for me to do it on the same side.
Sure.
And they agreed, but not a lot of universities do it. I remember when I gave the UNLV one, they did not allow me that. But they do have a chair that they
Right.
replace. So you can keep your handpiece on the left side and
Right.
the other suction on the right side. They do change it for you if you'd like, so that it doesn't like hit you, because it's hit me multiple times. The suction on the left side keeps hitting me because I'm always on
Yeah.
the left side. So yeah, some universities do allow you to do the other prep. Like if someone is doing 3, you can do the other
The
side. You
side.
can do 14.
Okay.
So
Okay, that's a
I
useful tip.
just
Thanks for letting me
remembered.
know.
So, Dhritika, you were at UNLV,
yeah,
right?
I was at UNLV
Do
as
you
well.
remember me? Because I just thought that, okay, when she said UNLV, I was like, okay, I've seen her somewhere. Okay. Yeah. So, anyways, I remembered what I was going to say. So, a lot of schools, so every school has a different kind of thing that they follow. Like, for example, even I just realized, apparently this was during the bench also. So, I don't know how I missed that. But so, zirconia prep. Okay. A lot of people think zirconia prep is equivalent to all ceramic.
Okay.
It's not.
Okay.
At UNLV, zirconia preparation is equivalent to a metal crown.
Okay.
Okay,
Okay.
so it's that minimal prep.
Mm-hmm.
Okay, it's not like all ceramic where you reduce 2 mm of everything.
Yeah, I know. This confusion was there till the time of the
Yes,
exam, and when we got the rubric, we got to know
yes.
it's not
We
the
had
all
a
ceramic, because I think a
zirconia
lot of
prep
people had
yesterday
that
at
confusion.
school on Friday, and that's when
Yeah.
our program director was like, "Don't think that it's all ceramic. I know it's
Okay.
zirconia, but stick to the metal preparation measurements." So please confirm if you are in doubt. Not on the day of bench, prior to that, because on the day of bench they might or they might not reveal
Yeah.
it. Try to get it clarified before itself. Of course, if it's a metal PFM or all ceramic, you might think that okay, this is what they're doing or this is what they usually do. No, not necessary.
Okay.
Because so many things keep updated in every school, they have different schools of thought. So it's better to confirm, even if you know. Even if you're a prosthodontist, just
Yeah.
confirm.
Okay, so I think we have almost covered 1 hour of our discussion, and I'm hoping that we have answered a lot of questions that you guys had. If at all you feel like we have still more to discuss, please feel free to DM us with your questions, and we will try to make another live like this to help you all with your questions. Thank you so much, Dr. Kirtana, Dr. Ditika, and Dr. Utsavi. Also, a huge shout out to Dr. Jagriti and Dr. Naga, who also came with us earlier in this conversation. I feel like this was a very honest discussion where you all shared out your experiences and kind of the challenges that you all faced as well. And I appreciate that you guys have been open to helping all of us in this journey. And I hope that you guys enjoy the rest of your Sunday today as well. Thank
Thank
you
you.
so much.
Thank
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 you.
you.
Thank
you.
you for
Thank you.
hosting it.
Thank you.
I hope it helped a lot of people.
Sure, it did.
Yeah.
And I'm hoping to save this live so that everyone can access it after this. And I do want to say that I'll put out the link for our WhatsApp group so you can join and get all the resources from Dr. Ditika and the others if they have anything. Also, the doctors here I just named, they're also our DSS ambassadors. So they are also on our WhatsApp groups. And if you ever feel like you want to have any questions asked, feel free to ask them and they'll try their best to help you out in the group. Right. Have a good day, everybody.
Thank
Bye bye.
you.
Thank
You
you.
too. Bye
Thank you.
bye.
Thank you,
Bye.
Master. Bye bye.